Today, we take you inside one of the most pressing issues in modern society: the true cost of healthcare in the United States. It's a story of staggering numbers, powerful industries, and the everyday struggles of millions of people. Join us as we explore the price of care, America's health spending. In the United States of America, healthcare is not just a service, it's an industry. An industry so vast that every year, it consumes nearly one-fifth of the nation's entire economy. The numbers are staggering, the consequences, life-changing. In the wealthiest nation on earth, healthcare is not just a necessity, it's a business. Every year, the United States spends more on healthcare than any other country in the world, yet millions of Americans still struggle to access it. This is the story of America's health spending, and the price of care. In 2023, U.S. healthcare spending reached over $4.5 trillion. That's nearly 18% of the gross domestic product. Put another way, almost 1 out of every $5 generated in this country went to healthcare. On average, every man, woman, and child accounted for more than $13,000 in health spending per year. That's more than most people spend on food, housing, or transportation. But the question is, where exactly does all this money go? The largest share, about a third, is spent on hospital care. Another third goes to physicians, clinics, and outpatient services. Prescription drugs make up nearly 10%. And then there are the hidden costs: administration, insurance profits, billing systems, and endless paperwork. In fact, the U.S. spends more on administrative overhead alone than some countries spend on their entire healthcare systems. It's a system that is as complex as it is expensive. Behind the numbers are the people. More than 27 million Americans remain uninsured. Even those with coverage face high deductibles, co-pays, and surprise bills. Every year, hundreds of thousands of families are pushed into debt, not because of reckless spending, but because someone in the household got sick. In fact, medical bills are the leading cause of personal bankruptcy in the United States. For many, illness is not just a health crisis, it's a financial one. America is not the only wealthy nation, but it is the only one where healthcare is so expensive, yet so uneven. Other high-income countries, Canada, Germany, Japan, France, spend half as much per person. Their citizens live longer, have lower infant mortality, and enjoy broader access to care. In America, spending more doesn't always mean getting more. The reasons are as layered as the system itself. Prescription drugs. In most countries, governments negotiate drug prices. In America, drug companies set the price, often unchecked. That's why insulin costs 10 times more here than in Canada. Hospitals. A simple overnight stay can cost thousands of dollars. A single MRI scan can cost more than a round-trip flight across the world. Insurance. The private insurance system adds complexity and cost. Multiple players, each taking a cut, each requiring more paperwork. Profit motive. At its core, much of American healthcare is a for-profit business. The incentive is not just to treat, but to bill. And yet, the United States leads the world in medical innovation. From breakthrough cancer therapies to robotic surgery, from biotechnology to vaccines, much of modern medicine is born here. But the cruel irony is this: many Americans cannot afford the very treatments their own country pioneers. Cutting-edge progress, side by side with crushing inequality. Some defend the system as the price of freedom and choice. Others see it as a broken model, where money decides who lives and who dies. Across the nation, voices rise, demanding reform, demanding fairness, demanding that healthcare be a right, not a privilege. If current trends continue, by 2031, healthcare spending in the U.S. will exceed $7 trillion per year. That's almost a quarter of the nation's entire economy. The debate continues: universal coverage, Medicare expansion, drug price caps, or free market solutions. But one truth is undeniable: the trajectory is unsustainable. The United States spends more on healthcare than any other nation, But the real cost is not just measured in dollars. It is measured in stress, in debt, in lives lost too soon. The question is not whether America can afford to spend on healthcare. The question is whether Americans can afford the system they have.